Now in Lagos, where 7 private laboratories in the state have been added to the 4 government laboratories that have been licensed to conduct tests for COVID-19. Now, this is to expand the testing capacity of the government and ensure the curve is flattened. Correspondent Theophilus Elama reports.
As the fight against COVID-19 intensifies, various state governments are putting measures in place to flatten the curve. Lagos, the epicenter of the virus, has been at the forefront of this battle. It has always been said that the state is at a level of community spread of the virus. This mindset has led the government to partner with private laboratories in a bid to ramp up testing capacity. Initially, 4 laboratories have been carrying out tests on patients for COVID-19. They include the Lagos State Biobank, Nigeria Institute of Medical Research, Central Public Health Laboratory in Yaba, and Lagos State University Teaching Hospital. The work has been huge for these laboratories, and that's why the private sector is needed.
To expand our testing capacity, we've identified potential opportunities for us to work with private sector, and we've identified laboratories that can do the sophisticated level of testing that's required for COVID-19. This graph shows you that we are now have reached a stage where we've diagnosed over 10,000 cases.
What is going to happen to public testing is still going to remain the same. Even with the offloading of those that want to know their status of the public laboratory, now we are able to test more. There is going to be reactivation and expansion of the working centers, and so that samples can be taken at the local government level. Then we've identified hotspots within the community where also samples can be taken in as much as those coming in fit the case definition.
These private laboratories have been licensed to test patients for COVID-19. While the public health laboratories are free, but the private labs will charge a fee for their services.
It costs between 40 and 50,000 depending on the market forces of reagents to test for COVID-19, one single test. The public health response testing remains free. It is borne by the government. If you want to be tested, if you're a company or an individual and you want to be tested, then you will pay for the test. And that test will be directed to one of these private laboratories that have just joined the consortium. That is the idea.
The state government believes that the inclusion of these private laboratories will help tackle this pandemic. Theophilus Elama, TVC News, Lagos.